Welcome, I'm Sean Haaverson, paramedic and instructor, and in this video we're going to review paramedic level anatomy and physiology as it is associated with the heart. Through a series of short videos, or as short as I can make on some of these topics, we're going to review a couple topics here. First, we'll review what makes up the mediastinum, what's packed into that tight space in the center of our chest. Then we'll review microscopic anatomy and physiology of the heart, make our way through the electrical system, anatomy and physiology. Then we'll zoom out and look at gross heart anatomy, circulation and perfusion, and eventually we'll look at the anatomy and physiology of vessels. First, let's start with the mediastinum. The mediastinum is tightly packed. This is a location where many things are located that are of extreme importance to the human body. So really, don't worry about memorizing all of these structures and trying to make them all out necessarily very rapidly, but pause the video and try to follow some of these lines and identify them. We will make our way through many of these structures along the way, but just wanted to point out everything that's located in this space. So as you can see, we've got plenty of structures. We've got here some nerves and nerve bundles, communicating with the heart, the blood vessels, measuring, sensing, sending signals, and so on. These structures here on this side, and then we've got some more of them here and here on this side, are going to be our bronchi. From lung tissue. We can see the dome of the diaphragm here, so the diaphragm curving in the background, the heart sitting right on top of it. We've got some large blood vessels, so these blood vessels and these blood vessels are going to be our pulmonary circulation. We've got the arch of the aorta here. We've got our branching to pulmonary circulation, kind of tucked back all these structures here. We have the vena cava. So there's a lot of stuff in this space. And so it makes it somewhat difficult for us to manage patients when they're complaining of pain in the mediastinum. The first thought might go to the heart, and rightfully so, because it's such a large organ, so important. But realize that there's plenty of other stuff here that we have to consider in our complaints and have to consider in traumatic emergencies as well. This image also shows some cutaway, showing some of the internal structures of the heart that we will definitely view as we make our way through. And then kind of set on top of all of it, let's see if I can trace it out here, are the lobes of the lungs. So the lungs sitting, this is really the only space that the heart has between the lungs when sitting in the patient's chest. So it's a lot that we've got to review. Let's dive in. First, I kind of want to show us where we're going to end up. So through this series of videos, we're going to end up being able to determine at any moment in the cardiac cycle what's happening on multiple levels. So this diagram is, I think, a very, very good diagram. But at first, when you look at it, my goodness, it can be confusing and probably stress you out. But don't worry, we're going to go through this multiple times and we're going to work on it piece by piece. But at the end, you'll be able to identify what's happening as the heart cycles continue, both electrically. So we have our EKG here. What's happening with heart sounds for our assessment. These are pressures. So we've got pressures of the aorta, pressures inside the left ventricle, left atrium, atrial systole as the cardiac cycle moves on over time. Here we have ventricular volume, so we can see what happens to the volume of blood as we're filling the heart and as blood is ejected out of the heart. Down in this section, it tells us specifically which valves are opening and closing through the electrical cycle, and that ties up back again to our time and the overlying electrocardiogram. Finally, in the very bottom section, you can see with arrows highlighting the movement of blood through the heart as the heart contracts, relaxes, and the pumps of the heart work in unison to create perfusion pressures and circulation. So we'll go through this as we go, but this is the goal of this set of lectures, is that you're able to understand certainly the anatomy, that's kind of the structures down here, but the practical physiology, which is all up here, so we can understand pathophysiology later, and included some things that included vital signs like heart sounds, electrocardiograms, and movement of things like our valves. So as we move forward, we'll kind of unpack this a little bit, but this is extremely helpful information, especially for folks that are visual or global learners where they need to kind of see everything put together to understand how the component parts eventually create what we assess in our patients on the outside. So let's talk about just a couple key pieces of information associated with the heart as it sits in the mediastinum. And we'll review this in great detail, but just to kind of get some of our orientation. So when you think about it, the heart is actually like a upside down triangle in the sense that the heart is sitting on the diaphragm. The heart sitting on the diaphragm is in an orientation in which the base, or the widest part of the heart, is at the top, and really it's kind of facing the patient's right shoulder. And the apex, or the point of this triangle that makes up the heart, is pointing somewhere towards basically between the left shoulder and the left foot. So we'll say left hip. Roughly, most patients, this is the orientation of the heart. The size of the heart is about the size of the patient's closed fist. So if you look at your hand and you make a closed fist with one of your hands, that's about the size of your heart. And just go ahead and place that over your sternum, a little bit left of the center of the sternum, right about where you think your diaphragm is, and that's the space that your heart is taking up. Here's a picture, again, kind of showing it all together. So in this, it's kind of mimicking a dissection. So we have some tools here that are pulling the lungs up and out of the way because, again, the lungs would naturally kind of cover the heart a little bit here. Then we've got our heart structure, and again, it's major structure, so we can see the diaphragm. We have the apex of the heart highlighted, and the apex of the heart, again, is going to be pointing towards the left hip. But it's really important because this is the point where the left and the right ventricles come together, and that's basically the center line. If we draw a line here, that's the center line of the heart, separating the atrial ventricles and left and right side. Up here, we can see where about the heart is sitting. And so an important point to notice here on this diagram is the point of maximal intensity, so the PMI. The point of maximal intensity is basically a reference to the point where you can hear the heart structure and movement and valves opening and closing best. And that is associated with a particular space called the fifth intercostal space. And if we notice, it's along the mid-clavicular line. So where we would listen to the apex of the heart, right, the apex of the heart is at the fifth intercostal space on the left side in most patients along the mid-clavicular line. And that gives us a few things. If we're listening, we can hear the apical, so think apex, right, apical pulse. So we can hear the movement of blood through that space, and could be useful in very small children when we're really not able to feel a sight for pulses. We can listen and hear the movement. We can't sense how much circulation and perfusion, but you can hear the movement, and that would be an apical and auscultated pulse. So this is also helpful for us to start orienting when we listen to heart sounds, which we'll talk about a little bit later, because the first orientation of heart sounds is to start generally in my personal practice at the fifth intercostal space on the mid-clavicular line, because that gives you kind of an overall sense of everything in the heart that's going on. And then when you need to narrow down specific valves in the heart, we'll give you some other areas of assessment to find them. I also like this diagram because it's showing here a cross-section with the posterior portion of the body at the top and the anterior portion of the body at the bottom. And we can see the lungs, so right lung and left lung, the spinal cord and vertebrae, and the heart sitting in the anterior portion of the chest. And of course, this would be our sternum. The heart is enclosed in a fibrous connective tissue, so not flexible sac, and the sac of the heart is called the pericardium. And here it's cut in this diagram to show you, but you can see we're trying to signify that there's connections of this connective tissue to multiple structures in the mediastinum, including the pericardial sac is connected to the top or superior surface of the diaphragm. So when the diaphragm moves, it pulls the heart a bit along with it. The heart, as you know, I'll just keep it simple, and we'll draw our triangle here with our base and our apex, and we've got right side and left side, is made up of four major chambers. So again, I'm sure this is not news to you. The upper chambers are the atria, and they receive blood, so they're the receiving chambers. They receive blood from either the rest of the body or the pulmonary circulation after it's left the heart. And our ventricles at the bottom, our ventricles are discharging chambers, and the discharging chambers send blood out of the heart to the rest of the body or into pulmonary circulation. So the way to memorize this, though, if it's something that you struggle with at this level, is the atria are sitting above the ventricles. So think of walking into a nice building, a nice rich person's home, and as you walk in, they've got some stairs to the side that go up, and you've got 3 stories in this building or whatever. And when you walk in the front door, you have this wide open space above you, the atrium. Generally, the atrium in a building is a wide open space above you. So the atria here is the kind of wide open space above the ventricles. And then the ventricles will be the lower chambers just below the atria. In this diagram, we can see cut away the anterior portion, and we're looking from anterior to posterior at the structures of the heart. Now, these structures are very important, but again, we will review them as we go through this multiple times to help you get it down. But if you take a screenshot of this, or you pause on this and start working your way through, or even better, draw and label this on your own so that you kind of get multiple senses involved, it'll help you memorize these structures. So let's go through. We're going to start on the very top left, what would be our patient's right side of this diagram, patient's left side. We'll start here on the patient's right side, and we'll make our way down through these structures. So we have our superior vena cava, reminder that's the largest vein in the body, and this is bringing blood as it returns from the upper portion of the body, so kind of above the level of the heart, that includes extremities, and neck, and head. That's bringing blood back into the receiving chamber of the right atria. Below here, though, just jumping down, we have the inferior vena cava, and the inferior vena cava is bringing blood back from below the level of the heart, so lower extremities, abdomen, chest, lower than the heart, all of those areas returning blood to the right atria. We have some connections that are sitting kind of across the top, but again, we're starting on the right side. So we have the right pulmonary artery. The right pulmonary artery is taking blood out of the right ventricle and then sending it in to the lungs. So this is going to go this way into the lungs. Now, here's a catch, and we'll go over this in arteries and veins later with the venous section, but just a really quick thing. If you learned that arteries carry oxygenated blood and veins carry deoxygenated blood, and then you had to learn there's a difference when we get to those terms inside the chest, let me make it a little bit easier for you. So just off the bat, again, we'll revisit this later. An easy way to remember is arteries. There's only one true thing about them that's always true, okay? It's not what they carry. It's the direction they carry. So arteries are always going to take blood away from the heart. So arteries away from the heart. Now, don't worry about oxygenation and deoxygenation as an always, because that depends on which part. As we can see here, the pulmonary arteries are shown in blue, which means that it's deoxygenated blood. But notice the direction. They're taking blood away from the heart and to the lungs. Veins, on the other hand, the thing that's always true about them is they take blood and bring it back to the heart, right? So veins always bring blood back to the heart, whether it's oxygenated or deoxygenated. So I'd suggest you start there, learning that arteries always take blood away, veins always bring blood back, and then once you start thinking about which arteries and veins you're talking about, you'll work out the direction of blood flow. And that's just going to take memorization and practice. The pulmonary trunk is the larger portion of the pulmonary artery before it bifurcates into the left and right arteries that go to the left and right lungs. We have our right atrium already labeled. So the right atrium is kind of in a picture like this, a little bit confusing. It's not actually as you might find it on a dissection, for example. We're showing that the atria is like a wide open chamber. But when you dissect a heart and when it's relaxed, the atria are folded down. They don't hold their shape when there's not blood inside of them. So after the atria is squeezed, they'll lay on top of the ventricles here, and you really only see most of the ventricles. The ventricles, for the most part, will hold their shape because of the structure and the amount of muscle that they have. Also notice, though, there's a difference in the amount of muscle that these atria, so here's our muscle layer, compared to the ventricles have. Here's our muscle layer in the septum, muscle layer on the right side versus the left side. So there's much more muscle in the ventricles as they are, again, the sending chambers. We have our right pulmonary veins. So remember, the veins take blood back to the heart. back to the heart. So our right pulmonary veins are oxygenated because they're bringing blood from the lungs back into the heart, and they will dump blood, oxygenated blood, back into the left atria. So again, the pulmonary arteries took the deoxygenated blood away, arteries away from the heart to the lungs. The pulmonary veins brought the oxygenated, now because it's been through the lungs, back into the heart. Let's see, we can, there's a few structures we won't focus a whole lot on, like our pectinate muscles at our level or fossa ovalis, although you can review those if you'd like to. The valves, though, are important. So we have our tricuspid valve, the tricuspid valve located here between the right and atrium, the left ventricle. And the tricuspid valve is a valve that we would consider an atrioventricular valve because it separates the atria and the ventricles. The valve on the opposite side is the mitral or bicuspid valve. Again, very similar, but separating now the left atria from the left ventricle. The right ventricle here, indicated by this large structure, as I'm sure you recognize. Chordae tendineae are connective tissue that are extensions of the valves, and then they attach to the structures called papillary muscles. So here's our papillary muscle. That would also be these structures here. And we'll describe how they work to hold the valves open and so on a little bit later, but they just give us a little bit extra opening to allow blood to drain from the top into the bottom as the blood flows through the heart. The trabeculae are going to be these open spaces in the inside of our ventricles that basically are really only existent when the ventricles are in their collapsed state, because they're folds that once the ventricles stretch out and get larger will basically smooth out because they're basically folds of the stretched tissue when it's collapsed. Okay, let's move over to the left side of this diagram where we've got our patient's left side of the diagram. So we've got our aorta branching off. So the aorta is a major artery taking oxygenated blood away from the heart, artery away. We have again our left pulmonary artery taking deoxygenated blood, which would have been out of the right ventricle, to the lungs. Left pulmonary veins returning, veins return blood to the heart. Now it's oxygenated because it came from the lungs, pulmonary. We reviewed our mitral valve. We have some valves that are also inside the blood vessels, the aorta, and our pulmonary artery. So the aortic valve is this valve right here, separating the left ventricle from the inside of the aorta. The pulmonary valve is this valve, and it's separating the right ventricle from circulation to the lungs. And the aortic and pulmonary valves then become, our semilunar valves. And the lunar part of it comes from their kind of crescent shape. The left ventricle, of course, below the left atria. Papillary muscles, we've already identified. We have the intraventricular septum. So when we say the cardiac septum, it's really the intraventricular septum that we're most likely talking about. And it's a muscle structure that separates the right and left ventricles from each other, but also carries our electrical conduction, especially between the atria and the ventricles. The myocardium is the muscle layer of our heart. So we've got a few layers that make up the heart tissue between our chambers. And the myocardium sits right in the middle of it. Myo for muscle and cardiac for heart. This is the layer of heart muscle. So these will be cells that we look at, and we already likely know a little bit about from our EMT basic training, but we look at as a source of creating the contractions. And of course, if there's a heart attack, we'll unfortunately probably die in the result of that process. On the outside of the myocardium, we have a thin layer called the pericardium. And the layer that's up against the heart of the pericardium is called the visceral pericardium. Visceral meaning organ. It's the membrane that's on the outside of our organ here that creates basically a package surrounding the heart tissue. The endocardium, endo usually describing within the heart, is the layer inside on the inner layer of our myocardium. So the myocardium is sandwiched basically between the endocardium here and the visceral pericardium here. So some major structures, again, work to memorize these structures. They'll all be of importance when we're reviewing the heart at multiple levels in the future. So as mentioned, we have a layer of muscle in the heart called the myocardium. muscle, myo, and cardium, heart muscle. And the myocardium is the primary thing that causes the contraction. And then we've got the endocardium, which is a smooth lining. And if the endocardium were not smooth, number one, it would lend to red blood cells being caught up against the structures of the inside of the heart and maybe clotting and staying too long. But there can be some negative consequences of this endocardium. The endocardium is generally very smooth, but it can be inflamed. And when it's inflamed, it's called endocarditis. So endo, within, cardiac, and itis for inflammation. Something that you'll learn about in our cardiac course later on. All right, that wraps up the just kind of introduction to the structures of the heart in the mediastinum. Now what we really need to do to prepare our understanding for various things, understanding how ECGs work, understanding how hearts work and what happens when they're diseased, like in heart attacks, and also understanding how our medications work, is requiring us to zoom in and understand the biochemistry and the cellular functions of our cardiac cells. So in the next section, we're going to look at the microscopic cardiac anatomy and physiology.